Do you know that certain motion, certain position, and even back exercises can actually worsen the pain and the symptoms that you feel in the lower leg and in your foot? Imagine waking up early in the morning and you feel this sharp shooting type of pain in your lower leg. That is called sciatica, and actually it affects millions of people worldwide. However, sciatica works like a puzzle. You need to do the proper exercises and you need to do the proper movement for you to get better. That's why in this video, I will share with you a very important concept that will help you determine and gauge if you're doing the correct motion and the correct exercises. Stay with me until the end because I will also teach you the specific motions that you need to avoid based on your X-ray and your MRI result. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. This video is to answer 2 questions from our subscribers. How would you know if you're getting better with sciatica? And what positions do you need to avoid? Before that, let me briefly tell you and discuss to you what is this pain and numbness in your lower leg and in your foot, and why is it there? Sciatica is a condition that causes pain, numbness, and even tingling sensation in your buttocks, in the back part of your thigh, your lower leg, and even your foot. So across this area here, it is considered sciatica because it is actually your sciatic nerve that subserves the function and the sensation in the muscles located here. Now, this happens if something like an osteophyte formation, a bone spur, or even a disc problem actually compresses your sciatic nerve. You can think of it as the discomfort and the pain that you feel because of an impinged nerve. Are you getting better? I have told you before that the treatment for sciatica are not the same. It is actually based on your X-ray and your MRI result. Or in the absence of an X-ray or MRI, the positions that make you feel better or gives you comfort. That's why it is very important for you to be educated and informed on the positions that you need to promote and the positions that you need to avoid. In this case, I will be discussing with you a very important concept that will help you determine and gauge if you're doing the correct exercises at home, regardless of the cause of sciatica. This is the principle of centralization and peripheralization of symptoms. For example, if before doing a particular movement or exercise, you feel the pain and the discomfort in your foot, but after doing a particular exercise, the pain is now located in your lower leg, that means that there is centralization of symptoms. Centralization of symptoms mean that the pain is now closer to the spine. When you're experiencing centralization of symptoms, this will tell you that you are doing something right, because this actually means that there is decreased pressure in the compressed sciatic nerve, which is actually what you really need for recovery. On the flip side, peripheralization of symptoms means that the pain is going further from the spine. So for example, if before doing the exercise, you feel the pain and the numbness in your lower leg, but after doing certain motion, you now feel pain in the foot, this is a red flag sign that will tell you that you're not doing something right and you need to reevaluate your position or your activities and even your back exercises, because these will tell you that the condition or sciatica is actually worsening. Now, what is your takeaway in this concept? This will tell you that if you feel numbness and pain in your lower leg or in your foot caused by sciatica, you really need to be mindful of how certain positions actually result in the relief of your symptoms. Before we continue about the specific motions that you need to avoid based on your X-ray and MRI result, I would like to ask a tiny favor from you to please click the like button below if you're learning something from this video and if you think this video is able to guide you to recover back your health. Thank you very much. That is deeply appreciated. Now to continue. At home, I want you to go back and check the result of your X-ray or your MRI. If you have seen in your X-ray results something like lumbar spondylosis, osteoarthritic changes, bone spur formation, you need to do the flexion exercise shown in this video here. If you have not done your X-ray and you feel better when you bend your trunk forward like this, you also need to do the flexion exercise in this video, which I will put the link in the description box below so it will be easier for you to get back on it later after watching this video. With this flexion exercise, you need to avoid extending your trunk like this because this will actually worsen and further compress your sciatic nerve. Now I want you to check on your MRI result. If your MRI result indicated disc herniation, disc bulge, disc protrusion, you need to do the extension exercises shown in this video here. In the absence of an MRI, if you feel better when you extend your trunk like this, you also need to do the specific exercise, which I will put the link on the description box below as well. If this is the cause of sciatica, what you need to avoid is bending your trunk forward like this. This will actually further compress your sciatic nerve and will worsen your condition. So if you need to pick something from the floor, you bend your knee and not your waist. This is to ensure that we prevent further worsening of your symptoms. So to recap, since this may be something new to you, if the cause of sciatica and the result of your X-ray indicated lumbar spondylosis, osteoarthritic changes, and bone spur formation, do the flexion exercise in this video. Do it 4 to 5 times a week. You can do it any time of the day. And try to observe centralization of your symptoms or even decrease in the pain, the intensity, and the frequency of your symptoms. You need to avoid extending your trunk like this because this will make your symptoms worse. Now, if your MRI result indicated disc herniation, disc bulge, disc protrusion, I want you to do the extension exercise shown in this video 4 to 5 times a week. You can do it any time of the day. And try to observe centralization of your symptoms, decrease in the pain and intensity, and even the frequency of your symptoms. This is it for this video. I hope that this video is able to help and guide you. If you have reached the end of this video, please comment free in the comment section below. Now, if you are confused or should you have any questions or you're not sure of the diagnosis, just type in the comment section below what is written in your X-ray and MRI result. I would really try to give time on this and try to give you the best possible options that you have. Just comment down below. Thank you very much for watching. I hope you have a great day. Stay healthy because your family needs you. I'll see you on our next video. God bless you.